Gary Schoenberg is a licensed psychologist in Pennsylvania. He's been in practice for more than 35 years, and he focuses on helping individuals navigate life transitions, anxiety, depression, and trauma. He works with both individuals and couples using a client-centered and collaborative approach to therapy. Gary is a certified psychiatric rehabilitation practitioner, a CPRP. He holds a master's in education and counseling from Antioch College, and he's going to talk about his perspective as an administrator who hired a pranic healer to provide services in a community mental health setting in Pennsylvania. Gary, welcome. Thank you so much for being here with us today.
Thank you, Allison. Glad to be here.
So, first question for you. As a licensed psychologist and a longtime administrator, what gap in conventional community mental health services were you hoping to fill when you first considered integrating pranic healing?
So, community mental health centers have been mostly focused on the medical model. And psychiatric rehabilitation is one of the modalities of that focuses on more of a holistic model. So pranic healing fits into that whole concept of more of a complementary kind of treatment that works really well with the medical model.
Awesome. And can you walk us through the administrative process of hiring a pranic healer? What steps did you take to ensure that the integrative service, this service, met professional standards within your mental health facility?
Well, one of the things is to make sure that it's in alignment, that the person has the skills and they're in alignment in terms of their experience with what we're looking for as someone who's a holistic practitioner and has some credentials, and training in the area of pranic healing. And in this case, we looked for a pranic healer. And I specifically was interested in pranic healing because I thought it was a viable modality that would work well with people with mental health challenges, with mental illness, people with schizophrenia, people with severe mental health, bipolar disorders, depression. And so you're really looking at someone who has some experience, perhaps who has worked with people with some of those kinds of conditions, or if not, a willingness to learn and develop their skills in those areas. So part of it is really looking at people's job description, the resume, making sure they're a good fit, and can work well with the population served and has flexibility.
Mm-hmm. Did you encounter any initial skepticism or resistance from traditional staff, licensing bodies, or patients? And if you did, how did you navigate those challenges?
Yes, some of the most resistant people were the staff who worked with the holistic practitioners and may have not totally bought into it. But one of the things that I encourage people to have open minds and to be optimistic and look at the possibilities and to really to trust that there are other different kinds of practices that can be incorporated into this model. And the staff began to get excited. And one of the things that helped was to have them experience the sessions themselves so they can be part of it and see the value of it.
And it was quite a period of time, as I understand. It was several years.
So in my organization, I worked with Pranic Healer is Comar. We're a community mental health center in Philadelphia. I worked there for over 40 years. And actually, I moved into more private practice since July. But I have a lot of experience working, in that organization. And yeah, so it really was, navigating some of the challenges around working with our funders and our people that regulate us, the regulators from the state level, the local level, the county levels, and really having an understanding of what the mission is for what we do, and that was that involved a lot of conversation and discussion.
Yeah. And you mentioned visible improvements in patient outcomes. Could you share a specific example or a brief case study that illustrates the impact of pranic healing on a patient's recovery? Anonymously, of course.
Yeah, so we had some individuals with schizophrenia who had one of the symptoms would be hearing voices, people talking to them, paranoia, hallucinations, and some people with depression. And the person that was doing the pranic healing, I would check in with him periodically and ask how things are going, and he would report back to me, and had some good anecdotal studies. They were really case studies, and people would present as some diminishing of their symptoms, whether it would be reducing of some of the paranoia or the voices, depression. People seem to be decreasing, and he would have some way of tracking that. He came up with his own way of evaluating that and would compare from week to week, and did share that he had seen some significant results in people that he had worked with.
Did pranic healing specifically impact the recovery of individuals dealing with anxiety and trauma compared with traditional methods alone? Was
Well,
there
we had some individuals that had people with individuals in our substance use abuse program. We had a program that worked with people with co-occurring mental health and substance use disorders, and some of those people had trauma histories. And I would say yes, that there was some degree of more peace, calmness that people would demonstrate after having pranic healing sessions, and we look forward to having the sessions that found them to be soothing and help them to feel a better sense of ease in their lives.
in terms of the documentation of the results that you needed to do, could you say something about how you documented and measured the results of the pranic healing sessions to maintain clinical credibility and to justify the program to stakeholders?
So the pranic healing would fall, as I mentioned, into the category of wellness. And so each of the individuals that we worked with had what they call the psychiatric rehabilitation plan or recovery plan. And the recovery plan would incorporate an aspect of how pranic healing is part of their recovery um, uh, plan. And it would be a modality. And so the counselor that was working with the individual would speak with them and talk with them, and they would report back on a weekly basis. Sometimes it would be just after each session, they would report back. Some of the counselors would gather information daily. Some would do it at least once a week. And the recovery plans would be within a period of 60 to 90 days. So they would look at it and see how is the person doing and their overall wellness. So the pranic healing would be incorporated into the recovery plan, and based on the feedback from the individual and the feedback from the pranic healer.
Excellent. As a certified psychiatric rehabilitation practitioner, as a CPRP, how does pranic healing align with or enhance the core principles of client-centered and collaborative recovery work?
Well, pranic healing falls into the category of wellness. And one of the aspects of psychiatric rehabilitation are there are core principles. And the principle of wellness looks at a holistic approach that includes mind, body, spirituality, physical, intellectual, um, financial, every aspect of a person. And it's very much a strength based model. So, psychiatric rehabilitation looks at what supports are needed to help that individual to get to a healthier place in their life, as opposed to the medical model, which is more of a deficit based model. What is the person lacking? What's wrong with that person? What's functionally wrong? Psychiatric rehabilitation will look at functional impairments, but it looks at it from a perspective of what supports and what is the individual's strengths and what supports will help to gain and leverage that individual's strengths. So pranic healing really, is very much it falls into that category of wellness and very much a good partner with psychiatric rehabilitation.
For other mental health administrators and clinic directors who are considering this integrative model, what is the single most important piece of advice that you would offer regarding successful implementation of pranic healing?
I think there has to be some buy-in on many levels from the administrator themselves who are interested in exploring this. I think it's important to have collaboration and communication with others to like myself, to be able to reach out and to just have some more in, better information to be able to share. This has been proven. This has been effective elsewhere to build data, build a case for support in terms of why you think this is some kind of a modality you want to utilize. And also, of course, to document. One of the things that is really big in mental health is evidence-based practices. So while pranic healing may not be an evidence-based practice per se, in terms of psychiatric rehabilitation, it could be considered maybe a promising practice. But psychiatric rehabilitation in itself is considered an evidence-based practice that incorporates different modalities. So it would certainly fit into the aspect of wellness that certainly supports psychiatric rehabilitation as an evidence-based practice. But I think building a case for the evidence of how pranic healing is being used, implemented to justify its being selected as a modality, and making sure that there's good documentation.
Gary, I think we're just about at time. Thank you so much. Thank you so much for sharing those experiences. If there are other facilities or administrators or folks in the conventional healthcare world who would be interested in learning more, is there a way that they can contact you, reach out to you?
Yes, absolutely. My contact information will be available through the Pranic Healing organization, and I can certainly be reached directly if people want to call me. I'll just give my cell number, 215-805-4845. I'll be glad to have a conversation and explore possibilities.
Thanks again, Gary.
You're welcome. Thank you.